Welcome back to Ozarks Tonight. Well, it is time once again for our monthly chat with a member of the therapy department from CoxHealth. This month, we're speaking with Gina Stiers, and she is an occupational therapist there at Cox. Gina, thanks for being here. To start things off tonight, just explain to us what is occupational therapy and what are some of the different ways that occupational therapists are utilized.
Hi. Okay. Well, we define occupational therapy in a way that we help people across the lifespan to do things that they want and need to do through the therapeutic use of daily activities, which we call those occupations. Basically, something you do on a daily basis or a semi-permanent daily basis, and it's important to you, we call that an occupation. You can find us in lots of different settings. You can find us working with children and adolescents in schools, in hospitals, on the pediatric units, in the NICUs with the little ones. You can find us working in the mental health settings, such as psychiatric hospitals. We also work in the community. Homelessness is a big issue, and we can be found in the communities working in outreach programs. And we also work with adults and seniors in other settings as well, nursing facilities, hospitals.
That's interesting that you say members that are homeless here in the area. Just kind of talk about, for folks at home, just give a couple examples of things you would work with for someone that is homeless here in the Springfield area. You can find us actually working with adults that are homeless, because a lot of times people that are homeless often struggle and have issues with things such as self-care. The occupations are things that they do on a daily basis. So being able to care for themselves, feed themselves, mental health and homelessness kind of go one in one sometimes. And so occupational therapists will be there working with the community. I think the Eden House, that new program, the Eden House, occupational therapists are working closely with that as well. For sure. For patients who are hospitalized, what do occupational therapists do at the Meyer Ortho and Rehabilitation Hospital, and what is their focus?
So here at the Meyer Orthopedic and Rehabilitation Hospital, we actually have three different units. We have an orthopedic unit, and those are often patients who have had hip or knee replacements, or maybe shoulder surgeries, rotator cuff injuries. They're usually elective surgeries, and we mainly evaluate them, educate and provide self-care strategies, maybe give them home exercises to work on. And we work directly with the surgeons. They will often give us direction as to what they want us to do with the patients after they've had their surgery. We also have a transitional care unit, which is like a skilled nursing setting. And there we're working with patients usually for a longer period of time. Our patients here are usually more fragile, have maybe other comorbidities or other underlying health conditions, and they're not quite able to participate in an intense rehabilitation program, but they're still getting therapy, just maybe at a lower frequency, not maybe 3 hours or more of therapy. But we are definitely working on increasing their independence with self-care and their functional activity tolerance. And then our third unit, we also have an inpatient rehabilitation unit. And there we are working with adults and seniors. And like the TCU, the transitional care unit, we are focusing on self-care. We also work on what are called instrumental activities of daily living. And those are things like being able to manage your own medications at home, being able to cook for yourself, clean the house, drive, take care of your pets if that's something that you have to do. It's just a higher level of a self-care, of an activity of daily living. So we'll work with
people on those types of things too, especially if that's something that they have to and want to do when they go home.
One of the common injuries that people oftentimes see are seniors that may be still living by themselves, maybe in their 80s or 90s. They might slip and fall and, break an arm, break a leg, a hip, or whatever it might be, and they might be in the hospital for an extended period of time. And that's when occupational therapists come in to, make sure that, like you've said, that they can do their day-to-day activities. At what point in time would you be comfortable with an older individual? When is it time for them to go back home, and when would you be comfortable with that after working with them over an extended period of time?
And that's something that we really focus on a lot here, especially on the inpatient rehabilitation unit. Like I said, the goal is to go home. That's always the goal, is to go back home or to be wherever they were before, but it has to be safe. That's the biggest thing. And so me as an occupational therapist, I'm working very, very closely with the physical therapist, with the speech therapist, with the social worker and case managers, and the doctors here. And collectively, we talk about and work with the patients on, I work on the ADLs. Can they go home and safely take a shower? Do they need help with it? Are they able to do it on their own? Do they need grab bars? Do they need to sit down on a chair? Would it be helpful to have a reacher grabber to help them so they don't bend over too far? We often see people here around 11 days, but we can see people longer if they're progressing and we still feel like there is a need and that they would benefit from rehabilitation therapy so that they can safely return home.
All right, Gina Steyer is an occupational therapist with CoxHealth. Gina, I want to thank you so much for coming on the show tonight.
Thank you, John.
All right, we'll be back with more Ozarks Tonight right after this.